Hi, I am Amanda Bullard. I am 32 years old from Bayleton, Alabama. I am married to my husband Josh, and together we have one child, Taylor, who is 11. She is a cheerleader, a gymnast, and a beauty queen. I've lived here all my life. Just a little bit about me. I went to Fairview High School, and when I left, or during my senior year and my junior year, I also dual enrolled my classes at Wallace so I could get through the nursing program quickly. I always knew I wanted to be a nurse. I went to Wallace straight into nursing school from high school. I graduated from there in 2005 with my associates. During my last couple of semesters, I worked as a student nurse in open heart ICU and open heart step down at Montclair. I had a scholarship with them, and we were permitted to work and learn all at the same time, and it was a great experience. But it was a really long drive from my house. So it was over an hour and a half. So I transferred to Coleman Regional Medical Center when I got my license and worked in pediatrics. I was in pediatrics for about 2 years, and I loved it. I loved everything about it. I would get certified in everything that I could. NRP, PALS, ACLS, BLS, anything that I could get certified in, I wanted to. I had this desire to learn and to keep going in my career. But I knew that that wasn't where I wanted to stop. And in the meantime, I had my daughter Taylor, who was born prematurely at 30 weeks. And so when she finally came home, I knew I probably needed a change of setting for her benefit. Not long after Taylor came home from the hospital, I moved from CRMC to home health. In home health, I gained tons of experience in independence, in learning my nursing judgment, in working on an interdisciplinary team, teaching patients and families, like really educating them, having to, really consider community resources and what each patient needs. So that gave me so much invaluable experience. Home health is really where I learned how to be a nurse at the bedside, even because it was really the bedside at home. So it was a really good experience for me, but I still wanted more. I just wasn't satisfied there. A friend of mine had told me about Bradford Health Services in Warrior, Alabama. I had no idea what it was, but I applied. I found out that it was a drug and alcohol treatment center. So it was addiction treatment, and I had never had any experience with it before. I started as a floor nurse in 2009. And they asked me to be charge nurse not long after that, and that's how I learned how to manage controlled chaos. You have all these balls up in the air that you can't drop. So it really helps me to learn how to prioritize, how to delegate, and how to manage really difficult situations. Bradford has 189 beds. We're expanding to 204 beds in the next few weeks. And so there's a lot of patients, but there's not that many nurses because it's behavioral health and not acute care. So it takes a lot to figure out how to best, provide the best care with the staff and resources that we have. And so part of being charge nurse, I learned how to do that. I learned how to really utilize everything to the max, how to get the most out of everything. And how to train my coworkers to do the same thing. So even as charge nurse at Bradford, I was learning how to be a leader, how to be a director of nursing by training everyone around me to do exactly what I did, which helped the unit flow, which helped take care of our patients, which helped them be happier because they understood what they were supposed to do. So it's where I got a lot of my leadership experience was on the floor. And from that, administration asked me to be the interim director of nursing in 2011 and the permanent director of nursing in 2012. And when I started doing that role, when I started functioning there, that's when I felt like I had really found my niche. Like I had come to, my whole entire nursing career had come to this point, and this was what I was supposed to do. So I'm leading a team of nurses. I am, helping to bring about change in our facility and making sure that we're implementing, scientific processes and things that have been proven, evidence-based. That was something that was really important to me, and I really didn't even know that much about it. So I immediately decided that I was going to finish my bachelor's and because I had started it when I was at CRMC. I had started the prereqs for it, and so I knew I was going to go back. I was going to get my master's and possibly my doctorate. But I knew I needed more. I needed more education to be able to do my job effectively. And that's exactly what I got from my bachelor's and master's program. I learned so much about how to do things correctly, how to implement evidence-based practice, how to research, how to review. Just everything that I learned there has really helped to make me a better leader. And in turn has really helped to change the way that I work in my current role. So I'm currently responsible for policy and procedure writing, implementing, educating, training. I do CPR for our entire facility. I'm the occupational health nurse. I'm the infection control nurse. I hold a skills fair for all my nurses every year, and that includes we have to get contact hours for that. I do monthly education with them. And lately I've been speaking at several places because, addiction treatment is not something that's really taught in the forefront at nursing school. They kind of teach you what you need to get through boards. And addiction is currently one of our country's largest problems. So 51% of Americans are affected by addiction in some manner, which means every single nurse that comes out of nursing school is going to deal with a patient that's affected by addiction in some manner. So they're dealing with our patients, but they don't know anything about them. Because it's just not something that's taught a lot in school because it's not the majority of what nursing is about. It's a small portion. So I've really had this passion to further that. I want to further my field. I want to educate nurses on addiction treatment. I want to, bring them in, let them see from a clinical perspective what that's like. So in my master's program, I implemented a preceptorship program for nursing students at my facility, and it has gone amazingly. So what happens is every semester I go around to each of the schools that's participating. We currently have 4 participating. And they send them, so actually at least twice a week, but I go and I do a little presentation for them on addiction, nursing, and opiates and things like that. And it's been really well received, and the patients really have loved it, but have loved getting to sort of help to mold new minds. But the nurses have really enjoyed the experience because it's unlike any other. Some have even expressed interest in working with us, which is or in addiction just in general, which is fabulous for our field because nobody really knows what we do. It is sort of very specialized. So we have been able to increase our retention rate with nurses in the past year, and we've really been able to expand our reach in the community. So basically, a little bit else about me. My philosophy of nursing is that nursing is an art and a science. So you have to have this, this great attitude, this feeling like it's your passion, this desire to do excellent and to really make your craft beautiful. But you have to do that with evidence-based practice. So it's the art and science of nursing come together, and that's really where we can shine as nurses, and that's where we can be a patient advocate, and where we can be compassionate and experience real bedside care. Have our patients experience that in a way that they've never experienced it before, because we genuinely care about how they perceive the care that they're given. With so many things being monitored nowadays, you have the HCAP scores that affect your payment and everything else. These patients don't want to feel like they're just money. They need to know that someone actually cares for them regardless of their situation. That's in addiction treatment and in the hospitals. So I really want to, my goal is to continue my education to my doctorate. I want to be a leader in my field. I want to be a pioneer for nursing, addiction treatment nursing. I want to let them know what it's about, what you can accomplish, how fulfilling the career can be, and how amazing it is to do something different and get to see that change in people. And I want to do that for my field, for the nurses that are coming, and for my staff that's currently with me. Right now, I have several that are in school because they were inspired by me. Since I was able to do it and work full time, now I have 4 going back. So it's been a real passion of mine, and I'm so thankful that I had the opportunity to go back, and I can't wait to obtain my doctorate from Jacksonville State University.